right, it's 10 o'clock, so let's get started. So good morning, everyone. Thank you for being here with us. We have about 50 of you on, which is amazing. My name is Sam Mello. I'm the program manager here at the Medical Society. On the call today, just so you all know, is both students taking the virtual only program and students taking the in-person program. So you will see a few more faces today and Friday than normal. But just be aware that the virtual only students, you're Monday, Wednesday, Friday for the next 3 weeks. And the in-person folks, you're going to be only virtual this Monday and Friday. So before we get started with our first speaker, I wanted to go over a couple of expectations and reminders. So please make sure your full name is in your Zoom profile. I need to count attendance, and I do that by pulling a report, and that way I need to see your full name in your profile in order to count you as attended. You're welcome to have your cameras on. We love seeing your faces. You will be asked to have your cameras on when we do small group activities. Other than that, I can understand if you can't have it on all the time, but the more you can, the better. Please be respectful and attentive to our speakers, to staff, and to fellow students. Rude language, bullying, inappropriate behavior will not be tolerated. Violating these rules may result in expulsion from the program. Please keep yourself muted when not speaking. You can use the chat function to ask or answer questions. We will do our best to answer each question, time permitting. If you would like to speak, please use the raise hand function and wait to be called on. We have a lot of students on the call, so we might not be able to get to everyone. All right, does anybody have any questions? If you do, you can private chat me or you can put it in the chat and we will address it. I will monitor the chat as we go. So I'd like to introduce our first speaker. So Dr. Eric Williams is a retired vascular surgeon and he is the Future of Medicine Advisory Chair. So welcome, Dr. Williams.
Thank you, and it's wonderful to be able to see all of these faces. You guys are very, very important to us, and you may think that for you it's a privilege to be here, but I think quite the reverse. It's a privilege for us to get an opportunity to speak with you. You would have gotten a pamphlet in the mail or an email that describes what's listed as a physician-patient relationship. I am going to start off with that, but I also wanted to say at the beginning that for those who are able to go to the in-person sessions, I want you to look at those sessions with this in mind. Whether it's a lab attendant, whether it's a pathologist, a physician's office, a nurse at the bedside, this approach is going to be there. And as you look forward towards medical school, you will find that this template is something, if you follow, you will be highly successful and you will gather much more information out of each and every meeting with a patient. You might even consider taking this home with you to your parents. That is sometimes quite an interesting feat. So give it a shot. So here we go. Do you all have the email that talks about physician-patient relationship first meeting?
Yes.
Okay, very good. So I'm gonna read through it. Then we'll come back to the beginning and we'll go over it again because I do want your input. I want your insight. Physician and doctor partake in a sacred doctor-patient concord. One trained in the art and the science of healing, the other in need of the same. They meet at the human body and the mind. And so it begins, an unobserved and remote interaction before the examination room, the overheard exchange and greeting by support staff. On this day, who speaks for the patient, or do they speak for themselves? The cadence of the voice, the fluidity of the speech, the hesitancy or spontaneity of words, the syllabic pronunciation. An image emerges into personal relationships, neurological function, and independence. The sound of the marching feet, unassisted, caned, or wheeled, says able-bodied, disabled on one side, or non-ambulatory. The cause to be determined: neurological, generalized motor, nutritional, or absence of limbs and or digits. All these, while known history is reviewed to complete the pre-communion. Now, both present in the examination room, they sit at the table with trust and reverence, one to give attention and the other to receive, both alert to cues and clues. With eye contact, acknowledgement, and reassurance, the observed interaction begins. Now together, the doctor notes recall and memory, the easy and the hard, the spoken and the unspoken. Visual inspection for unevenness of posture, splinting, facial and body irregularities, gait, speech, odor. All this before physical contact, now placed in context. Listen, auscultate. Appropriate that first touch, a now rubberized stethoscope invented by René Laennec, placed upon the chest and back, reflecting the beating heart and the unobstructed movement of air by which the patient breathed daily life into themselves. Understanding and following simple instruction. Breathe in through the mouth and out through the nose. Heart and chest exam and the beating heart in appropriate rhythm and rate. Blood flows through every millimeter of the body. The soft rumble of the undisturbed abdomen with numerous organs will speak volumes to a quiet audience. Muscle strength, reflexes, languid versus spontaneous, sensory ambivalence or hypervigilance are noted. A physician's responsibility of pronouncing the news and a personal plan marks the moment and the end of the sacred accord. We're going to go back to the beginning now. And let's see if we can see your faces again, because I'm going to ask you some specific questions here. So what did you make of that first section where the doctor and patient, or the physician becomes aware that his patient or her patient is there, but they have not yet met? David?
I'm sorry, could you
David
repeat the
Araya?
question again?
In that very first section where the physician becomes aware of the patient, that he can hear that the patient is there meeting the associated staff, what did you think about the relevance or the significance of that first meeting?
Being aware that you have a patient makes the doctor know that they need to approach the patient in an appropriate manner.
Okay. Anyone else? I think you're speaking. Yes, go ahead. I can hear you
Sorry.
now.
I feel like the first part actually dedicated to the relationship of like being the patient, because like as you're a doctor you need to make comfortable for the patient, and like start like there was the introduction of like how can you do the like by starting how can you talk to your patient, like how you need to kind of behave in order to like get to know them.
Okay, good. And this meeting, this first meeting is remote. The patient is not in the examination room. They're not in the doctor's office. He cannot see them. He's at a back table reviewing the patient's chart. And yet, one of the things that the assistant is asking them is, what's your name? Can I check your weight? Can you walk? Can you step on the scale? The physician may not be able to see these things, but they can hear that it's happening. And from those things, you gather information. Can the patient walk? Does the patient have a memory such that they can answer what medications you're on? What did you have for breakfast this morning? That says a lot about the patient's condition. Is it a 12-year-old or is it a 75-year-old able-bodied or a 90-year-old severely inhibited? So even though you're unable to see the patient, you're hearing that exchange and you're creating a mental image of the person that you're about to see. It says something about what sort of questions would I ask them? Who would I address? What information will I try to elicit? What am I looking at? How debilitated will this patient be? How will my recommendations fit this patient? Because many times in medicine, you're not going to do something simply because you can. You need to do what's appropriate and respectful for that patient and the family. And I mentioned the matching feet. Anyone here speak French? There's a term called marcher petit pas, walking with small steps. That's something we tend to see in Parkinsonism. And I suspect with the number of you here, there may be some of you whose family has been affected by that. They walk with small shuffling steps, and you can pick that up. Are they walking with a cane? So now the patient is in the room, and the physician has not touched them. They haven't spoken to them, but they are observing the patient. Have any of you ever had an injury where you were unable to use one arm or you were twisted in your back because it hurt? It's called splinting or protective behavior. All of that are observances that you might make when you're examining the patient. And as you do that, you're being that much more careful and gentle with that patient because you are aware of these things. Take the abdominal exam for a second. You've got a ton of organs in your belly. Most of you have done biology already, yes? So you're aware that your liver, your spleen, your large bowel, your small bowel, your kidneys, they're all there. And they should not be prominent, but you can sometimes see them, particularly if you've got someone who has lymphoma and the spleen is enlarged. So you're observing all of these things. Use all of your senses. Look, listen, even before you touch the patient. And use your sense of smell. People who have diabetes have a certain fruity odor, and you can pick that up. People who have certain type of wounds or lung infections, again, have another. All of these are cues and clues as to what's taking place with your patient. The point I'm making is when you walk in and you meet a patient, meet that entire patient. Meet them socially, physically, and mentally if you really want to touch bases with them. Even before you put a stethoscope to the lung, and that's what auscultated meant. I suspect some of you have looked up the word already or asked Siri, what does it mean? But you listen. Rene Laennec was the person who invented the stethoscope ages and ages ago. We've modified it quite significantly to now make it a small computer, but that's what it is. And you can listen to the abdomen if it's making a lot of noise or if it's absolutely quiet. Both of those mean something. You will hear a gentle, constant rumble in it. That's normal. Or if you came to the doctor's office and you hadn't eaten for about 4 hours, you may hear a loud rumble, and the patient may even feel it and say, I'm sorry for that. Your stomach is empty. And at the end of all of that interaction, the physician is now responsible for saying to the patient, this is what I think, this is what I'm finding, this is what I'm recommending. That is made with a sense of who this patient is. You have to certainly grasp that patient and their family members and what's appropriate for them. And then listen to them. What is it they want? They may not want what you're offering. They have a choice about it. They chose to come see you. Now it's your responsibility to listen to them. Thoughts, questions? I'm expecting at least 3 questions from this. And we have 2 minutes to do it. Mary Jane? Mary Jane Walker?
Yes, sir.
Yes. Do you have any
I'm
questions?
having like bad connection.
Okay, I see
Like I
that.
can't really
Ava
understand you.
Snowden? Okay.
Yes.
Ava,
Mhm.
do you have any questions, insight into what you read or what you heard?
No, sir.
You do not? Okay. I will say right off the bat that there are no bad comments, no bad questions here. I want you all, starting now, to feel comfortable speaking up. One of the asks that we have in this program, particularly for those of you who are in person, would be to observe the area that you go to, the physicians you work with, and at the end of the program, we would like you to make at least 2 recommendations. 2 recommendations that would make a difference in patient care from a patient perspective or caregiver's perspective. It's going to be really important because the program does mean you are the future of medicine. That's who you are. And we can't get there unless we're listening to you. Sam, let's go to the presentation.
We have one question from Jody.
Yeah.
Okay, very good.
So I'm looking through the paper right now, but I don't really see anything related to eyesight or having to do with the eye, like or inspection or the inspection of it. So maybe that could be added to it.
Okay. And when you, let's see, when it said inspect, that's where you're just observing. Okay? You're
Okay.
looking for unevenness of posture. You're looking for splinting, facial and body irregularities. You're looking at the way they walk. So that's all observing. You know, what is it you see? But I will make that more, I will clarify that in the piece. Thank you. Thank you, Jody.
No problem.
So as I said, you're in the Future of Medicine program. That's what this is. That's who you are now. Let's go to the next slide. Anyone recognize this gentleman, the bust of this gentleman? This is Hippocrates, the father of modern medicine. So you want to be a doctor. How do you get there and why? Next slide. Just a little bit about myself. As Sam said, I'm retired, and you are absolutely my replacement. But we need more and more of you. And as we look forward to the year 2030, we are coming up short 121,000 physicians and healthcare practitioners. And we're just talking physicians here, not nurses, not technicians, physicians. We are so desperately in need. So if you do want to do medicine, we have room for you. And the question you will have to ask is AI going to change the face of medicine? Is that going to help change the equation and the shortfall that we have in delivering medicine? We do need more women in medicine, but we also need more minorities in medicine. Equity is becoming a bad word, but patients do better when they feel that this physician really identifies with them. We know that. That is a fact. That is science. Next slide. This date is really important to me. December 3rd, 1967. Dr. Christian Barnard performed the very first heart transplant. And when he did that and it was announced on the radio, this is what propelled me towards medicine. I was 9. I was standing at the storefront in Trinidad and Tobago. If none of you know where Trinidad is, it's the very last island before Venezuela, if you follow the chain of West Indian islands all the way down. And I was waiting for my bus to take me home, and the gentleman was playing his radio very loudly, and I heard this. That sparked my interest. That caught my attention. I was captured by medicine. Medicine chose me. Next slide. Who is this guy? All of you know him. And why is he important to vascular surgery? Well, you know, this poor gentleman, as much as he's given to us, he died in 1955. He was 76. This is Albert Einstein. And what he died of is on the next slide. That area you see there that's marked with a hashed line and 56.2 is an aneurysm. This is a CAT scan of a person. The lower part of your screen is the backbone. The front part of the screen is the top of the abdomen. The aorta rests on the backbone, on the spine. And he developed an aneurysm of his aorta. And when it ruptured, he died. We did not have the technology. We did not know how to repair these things at the time. We've come a long way since then. And we now repair them with small puncture wounds in the groin or even in the neck. And the patient goes home the same day or the following day. Next slide. So what is it I did as a vascular surgeon? I repaired aneurysms of the aorta, took care of carotid arteries, whether they were aneurysmal, meaning enlarged, or if they were blocked and causing strokes. There are vessels throughout your body feeding your gut, and we call that the mesenteric vessels. Those too causes a problem, and you have to be really keen and listening and examining your patient to determine if they do have a problem and the severity and acuity of it. The other issues here that are discussed, probably the most significant one would be vascular access surgery for renal failure patients. And as we get more and more patients with diabetes, renal failure and dialysis becomes much more common. Next slide. So how do you make your career choice? There's something called a fit test, and at the bottom is a link to a site that will allow you to do a free fit test. You must look at your interests, your skills, what is it you naturally gravitate to, and of course your pocketbook. There are different ways to surmount the pocketbook issue, and that will be discussed at another point. The willingness to commit an extended period of your education, because you're looking at 4 years of undergrad, another 4 years of medical school, anywhere from 3 to 5 years of residency before you can begin working. And even while you're going through residency, you should feel free to make a change, look, medicine is what I thought I wanted to do. I thought I wanted to be a pathologist, but I realized surgery is what I prefer, or pediatrics, or OBGYN. Be willing to make those changes. Life will go on. Next slide. But why do this? I talked about the long hours of studying because I use a phrase called good tired. After you've worked with a patient and we stayed with them in the operating room for 6 hours, and at the end of which you're tired, you can barely stand on your feet, or you're going home in the evening, you're tired, but you know that you've done something to change someone's life. You're good tired. It gives you an intimate knowledge of the human body. What can it tolerate? What can we do to make it better? You get introduced to cutting edge technology that truly and definitely changes our lives. And there's, without question, you have a secure financial reward at the end of this profession. Next slide. Here's some reading recommendations. We'll have to try to find a way to get these to you because I think certainly the first one here, Premonition by Michael Lewis, speaks about how we dealt with COVID. There's going to be another COVID, and how we handle it will determine how we manage. David and Goliath talks about taking something that's a negative and amplifying it and becoming successful. Anatomy Made Ridiculously Simple is a good anatomy book for you. It makes it really easy to understand and remember anatomy. Emotional Intelligence talks to you about how you study, how you relate to people. It is intelligence goes beyond book sense. And When Breath Becomes Air is a book that speaks about a physician who developed cancer and while he was a resident, and how his wife supported him and the entire medical community supported him, and she completed the book he was writing. It's a great book to read. Next slide. So this is who you are. This is where you are right now. We will come back to getting sessions like this in person, but not just yet. Next slide. The view is long. You can barely see the horizon, but it's there. Just start moving forward. We need you at this point. Let's go back to the group. Thanks, Sam. Questions? Miranda? Yes.
I have no questions. I understood. Thank you.
Okay. Regina? Okay, Regina, I'll make this easy for you. Why are you here?
I'm here because I have an interest in being a radiologist since most of my family members are in the healthcare field.
Okay. In what areas of healthcare, if you don't mind me asking?
My mom's an RN. A aunt from my dad's side, she's also a radiologist. And then pretty sure my other aunt, she's also an RN. So yeah.
Okay. The David and Goliath is important and I think applies to me. And I would say to you and give you some insight as to where I came from. I am one of 11 children. My father was a mechanic. My mother stayed at home. There is nothing in my past history that said I should have been where I was. And yet, here we are. Even if you feel disadvantaged, even if you feel that there are people in your life who are detractors and challenge you, that says you can't do this, there are some out there who support you. Find them and hold on to them. Stay connected to them. Whether it's an aunt, uncle, a teacher, a friend, a physician, you will meet some of them. Use them as a resource. They want to be there for you. Thank you for listening. Thank you for being here today.
We have one more question.
Okay.
I don't want to butcher your name, so can you tell me what your name is?
You could just say Simran.
Oh, Simran. Okay.
But
Simran.
so you mentioned, Mr. Williams, you mentioned a lot of positives of being a doctor, like the good tired and different things like that. But what's some negatives you see on a daily basis, or maybe not so on like a daily basis, but just something that we are going to see if we pursue that field?
Yeah. One of the things you're going to see are the pressures of sometimes giving bad news. That's hard. That's hard. And you really have to use as much of your empathy and emotional intelligence in trying to deal with it. And then after you've done, move on to the next patient. It doesn't mean it's not going to sit with you for a long time. It will. And that good tired, that's also a negative because you're tired. You have to take care of yourself. You have to keep some of that energy back for you and your family. You have to have a life. You must have balance. And some people deal with it with a sense of humor. Some people go jump out of airplanes, perfectly good airplanes with parachutes. People do it differently. I knew one emergency room physician who did that. He was a skydiver. But that's just not me. But there are negatives. There's a tendency to try to do it all by yourself when in fact you have a team around you. We cannot do this alone. We have to do it as a team. We have to lean on each other and keep looking forward. Suketa had a question.
You mentioned that you wanted to like become a pathologist at some point. So my question to that is, what made you like think that, oh, I don't want to be pathologist, I want to be a surgeon? Like, what was your like thinking? Like, when did you think about that?
Okay. If I said I wanted to be a pathologist, I misspoke. Um, if I could, I would tell you I considered being a priest at one time, but that's another story altogether. But I'm a very hands-on person, a very creative person. I think out of the box. And in surgery, you may go in with a plan, and yeah, some what we call game time decisions, depending on what you find at the moment. You have tools and you have to figure out how do you best use them to take care of that patient. Now, having said that, we were quite surprised probably about 9 years ago as we introduced pathology as one of the places students would have an opportunity to go, that many students were very interested in the human body and getting that intimate through the microscope look at the human body. What goes wrong with it? How do I provide information to the surgeon or the physician or the other healthcare team so that they can take the best care of this patient for an outcome that would be really something that they would be proud of.
Our next speaker is on, but we have time for one more question. Jessie?
Was there ever a time where you felt like personally challenged, maybe in med school, and you doubted whether this was the correct profession for you? And how did you overcome this challenge?
That is more of a loaded question than you could ever know. My when I attended med school, I had some personal issues in my life, and that second year of med school was very difficult and very challenging. And I actually left med school and went back to American University to just study biology and medicine and healthcare. Came back to medical school. and completed the program. But during that period when I wasn't there, it was very devastating. It was quite depressing. And I had a choice. Do I lay down and decide I'm done with this? Or do I get up and move forward? And the secretary of the admission admission clerk said to me, Eric, you know, sometimes this will happen. You've got to stoop to conquer. Sometimes you will fall down to your knees, but then you get up again. Thanks for that question. It's not something I speak of very often, but if it's something you want to do it.
All right. Well, thank you, Dr. Williams, so much. And just so everyone knows, Dr. Williams is available, and I'm going to share his contact information, and he will be back at the end of the program as well. So you'll have plenty of opportunities to pick his brain throughout the program. But I wanted to transition to our next speaker. This is a physician, Dr. Elise Harris, who has known she wanted to be a physician from a very young age. She's in internal medicine at UC Davis. She grew up in the Sacramento region. She attended Franklin High School in Elk Grove. She went to college at Sacramento State, attended UC Davis Medical School, and stayed local to practice. She's here to tell her story and some challenges she overcame to achieve her goals. So please welcome Dr. Elise Harris.
Hey, everybody. Wow, this is a nice looking group. A lot of diverse, beautiful faces. So thank you so much, Sam, for inviting me to come and speak. I'm so honored and really delighted to be here to speak to you all. This is certainly the time to start thinking about health professions if that's what you're interested in. It's never too early. And so it's really good to be here to chat with you all about my journey. So just as Sam said, currently I'm an internal medicine physician over at UC Davis. I split my time, a little bit of clinical time, and I do a lot of teaching with medical students and residents. So I'm like about 3 days in my clinic, and the rest of my time I do a lot of teaching. So it's really fun to come and talk to you all about this because I do a lot of this all the time. So a little bit of background about me. I was initially born in SoCal, but I did spend most of my time up here in Northern California, mostly in the greater Sacramento area, Elk Grove specifically. I didn't grow up in a very rich family. My family is very low to middle class. No one in my family no one in my family were doctors. No one was in healthcare professions. My father was the only person who actually had a bachelor's degree. He did eventually get a master's degree during my youth, but he's like pretty much was the only person in my family that really had a lot of education. But it was in a completely different field than I was interested in. So I really didn't have anybody to kind of guide me when I was thinking about becoming a doctor, which is a whole interesting story on its own. But the short version is I remember seeing my two very rambunctious younger siblings come back from playing outside with like wounds and always bleeding from these wounds. And I just got very curious as to what was underneath that wound. Like, where is this blood coming from? And my mom ended up buying me some age-appropriate anatomy books at the time. I was only about 6 or 7 years old. And I remember just love reading those books. They were those kinds of books, as you turn the page, it would like kind of reveal a different layer of the body. Yeah, so it was like, the skin, and then you turn the page, and it was the circulatory system with those organs, and then the muscles and the bones and the nervous system. And I just couldn't get enough of it. I just really loved it. And so that's kind of where my love, I think, of anatomy and physiology and science kind of grew out of. I'm kind of nerdy by nature. I always really liked school. I always did pretty well at middle school and high school growing up. I definitely kind of, geared more towards those kind of science courses. And so school wasn't too bad, but when I got into college, that's where things really changed. College is much harder than middle school or high school, especially if you don't come from private school training or rigorous academic training as a youngster. Getting to college was definitely difficult for me. And I was someone who had a vision. I knew what I wanted to do. And I was focused. I wasn't, in a lot of other social things, but it was still very challenging. It took me some time to get my footing the first couple of semesters in college. And I didn't really have my community of people. I didn't really have, Dr. Eric Williams was just mentioning before, having this community, this support network. Most of us, if you don't come from a family of doctors, this is not a journey you can really do alone. You need mentors, you need support, community, people who kind of encourage you along this journey, because it's challenging. And even once you become a physician, it is still challenging. So getting back to what I was saying about kind of getting through school, a lot of focus that was required of me. I even remember very early on when I started college, counselors kind of wondering if medical school was the right option for me. In fact, I remember one telling me that I should take an aptitude test, which is a little test that tells you maybe what a good career for you would be, and really discouraged me from becoming a medical doctor and pursuing that. And I unfortunately encountered a few other professors at my college who, told me that they didn't think I was going to get into medical school except through some affirmative action program. And this was when I was actually doing well in their class. Like I remember having like a B plus or an A minus in the class, and someone telling me like, "You're not going to make it." So, there was some haters, there were some naysayers along the way, unfortunately, but I kind of just kept pushing forward. I kept going. My family is really, really supportive of me and my goals, and they kind of kept pushing me. I'm a big faith person, so I just kind of kept taking that with me and moving forward. I knew that I wanted to be a doctor, even though I don't think I really fully knew what all a doctor did at the time, but I knew I wanted to help people. I knew I liked people. I knew I loved people. And I think that is the crux of a lot of physicians is you do really need to like or love people, right? This is a service industry. We serve people all the time. So if that's not a part of the passion, you might be somewhat disappointed becoming a physician or going into any type of healthcare field where you're taking care of people. You got to love people. So I eventually found my way to this really great program at Sac State called SEE. It stands for Science Educational and Science Educational Equity Program. And that ended up, I think, becoming really a saving grace for me. I was mentioning about needing that community and mentorship, and that's exactly what this program provided for me. It was intended for people interested in going into health professions, and they set us up with all kinds of opportunities to do research, to do shadowing opportunities with other physicians or other healthcare people in the community. They helped us with our medical school applications. They gave me some volunteer stuff that I did with UC Davis, um, mentoring and actually doing some educational presentations at women's shelters. And I think from there just started kind of pursuing all of those different things and just finding other ways I can serve my community and love on my community, which I think a lot of medical schools are looking for. They're looking that you love people and that you're serving people in your community or trying to make changes in your community. I think I was also a peer health educator on my campus, which we kind of focused on doing educational pop-ups for students on our college campus around harm reduction and sexual health information and all those types of things, which was really, really fun. The SEE program ultimately uh, connected me with the medical school preparatory enhancement program, which is a fancy title. It was called MESPEP, and that ended up being really the one-stop shop for me because it was connected to UC Davis. It was a partnership at UC Davis with Sac State that took Sac State students and basically helped us get some more resources at UC Davis to begin to apply for medical school. So they helped with our, MCAT, education, the courses that you take to prep for MCAT, helped us learn how to interview for medical school, helped us with our personal statement, our application, and all of that. And I got ready, and they helped me do that so that I could apply to medical school. And that is where I found another really great community, a lot of great mentorship, making connections, networking, right? That's so, so important. You have to go network, be social, get to know people. As you get to know people in different areas of the health profession. They can introduce you and connect you with other people who share their experiences that you can learn from, or help you get into programs, right? Access other resources. So that's really important, to network and be social. And from there, I was able to meet the dean of diversity, who, you know, advocated for me as I was applying to medical school. Mind you all, that I didn't have that bad of a GPA. I actually had a pretty good science GPA, but my MCAT was just so, to be really honest. I've always struggled with standardized tests. It's always been difficult for me. But having someone that kind of could advocate for me on the inside, right? And then having this long service application of all these great things that I had done in the community and good, strong letters of recommendation really helped me to get into a few options for medical school. So I ended up choosing to stay at UC Davis for medical school, which was great. I ended up doing my residency at med school. I did my residency at UC Davis, and then I stayed on for a chief year. And now I'm faculty at UC Davis, and I'll be celebrating my final 2 years out in August, which is pretty cool. So, just wanted to touch really quickly on someone else's question about I think someone made a question earlier to Dr. Williams about kind of just getting over setbacks. So I just want to share really quickly, I have gone through a lot of setbacks. I had to apply for medical school twice. I had to do my MCAT twice. I had to do my boards once I got into medical school. I had to do my first boards test twice. So I am no stranger to setback or just having challenges, right? For me, it was academic challenges, but there's other challenges people face. They can be emotional challenges, mental health challenges, physical health challenges as well. So for me, it was just academic challenges. So just having to retake standardized tests was just kind of a all too familiar saga in my life, right? And so I think some of us, most of us, all of us probably will face some types of challenges. I just want you all to not take those challenges as necessarily a no, as a door closing, but figuring out maybe you might have to get creative. Maybe it might take you a little bit longer to get to where you want to be. Maybe you'll have to try again, or come up with a new plan. But I think if this is something that you feel is rooted in your heart, whatever you decide you want to be, focus on that. Be determined, keep pushing forward, find a way to get there if that's what you feel like you are meant to do and meant to be. And just get your community, find your community, your mentors to help you along that way. And whatever other things that might be an aid to you, whether that's a spiritual thing or faith, church, religious group, whatever else that might be to kind of aid in your process of getting to where you want to be. Keep pushing, be determined, and just listen to your own inner voice. Don't get distracted by people telling you that you can't do this. You are very much needed in whatever you're choosing to do. I know there's a lot of different people on here. You might all have different things you're interested in doing, but whatever, I love that last picture that Dr. Williams, you put on your slide. We need you. We need you. You all reflect the communities that we are serving right now here in California and across the country. We have to change and shake up the face of the old school way that we've been doing this. And so it's so important that we get our young people interested in this, our diverse people interested in becoming some of these professions. And there's lots of ways to help you, even the playing field in a way, right? That's what equity is, evening that playing field to get you to where you want to be, because you may not have all the resources that are needed for someone else coming in who has a lot more resources or privilege that you may not have come in with. But there are ways to even that field. So find out what they are, talk to people, network, and keep pushing. I think that's all I wanted to share today. Thank you, Sam.
Thank you so much. You have a very inspiring story, and I appreciate you sharing with everyone on the call. Does anyone have questions for Dr. Harris about her process in becoming a doctor?
I do have some questions.
Yeah, go ahead.
Okay, as you dedicated earlier, like your family wasn't like rich, it was like just middle class. So were there like some financial like challenges that you faced during like med school, getting that time?
Yeah, that's a great question. Absolutely. And, this was before a time when there was a lot more like TikTok and social media and YouTube to kind of, let me know how other scholarships and other things that could help me with that. So I had to keep a small part-time job during college, which I think was, helped to divide up my time, right? I didn't get to just fully focus on doing school as I did also have to work to pay for school. It taught me a lot about balance, that's for sure. It taught me a lot about how to use my time effectively and efficiently and to be focused. But now there's a lot more scholarships out there that help with school. So I think you just have to Google and search for what's out there to kind of help financially on how to get there. There's programs that help you with applying to medical school. There's programs now that even go like the college and med schools kind of combined. I know at UC Davis, we have like an ACE-PC program, which is medical school in 3 years, and that whole program is paid for. Yeah, there's way more out there, probably more than I can even articulate. But I would just encourage you to, use the internet to find other resources and ways to help pay for school. But there's a lot of money out there, lots and lots of money out there. You have to apply for it.
Before we get to Simran, I wanted to also mention, since you are all local students, so the Medical Society does have a scholarship program as well for students who graduate high school in the Sacramento region. They're actually eligible once they get into medical school to apply for a scholarship through the Medical Society as well. So they are out there. I agree. It takes a little digging, but you can find them. Simran.
I just had a more of a simple question, but when you started applying for med school and when you went through that whole thing, did you like set a limit from what for like which colleges you want to apply? Like, is it similar to like going from high school to college, or is it like the search for like where you're gonna apply different?
Yes, the search is probably a little bit different. There is kind of published data out there for medical schools in terms of everything you can imagine. So how big the class program, like how big the class size is, right? Is it 100 students or is it 200 students? What is the demographics of what those students look like? How many people did they take were of certain economic status and certain ethnic groups? And then what their GPAs were and what the average MCAT is. So you do have to be strategic. So most of the time when we're applying to medical school, we break it down in kind of three big buckets. So schools at the bottom of that, totem pole would be schools that you're like, I'm pretty sure I can get in here. I have higher than their average GPA, higher than their average MCAT. And it may be that school's not as prestigious in terms of the breakdown of the how many schools are out there, right? And it's like a shoe-in basically. So that's the bottom tier. Then the middle tier is like, I think I can probably get into here. It may not be too much of a stretch. And then you have your pies in the sky, right? So those are schools that are probably a little bit outside of your league. Maybe those are more of your wish list schools. Like it'd be really great if you could get here, but maybe you don't meet all of their criteria, their average criteria of the student that they take. And we do usually recommend that you limit your pies in the sky, but probably shoot for more of those middle to lower tier schools that you can definitely get into with a smaller portion focused on your pies in the sky. But all of that data is published and it is a meticulous process when you're thinking about the number of schools you want to apply for, because every school you apply for, it takes money. So I think they give you the first 10 or so is like free, or it comes with so much money, and then every school you add to that, right? It might have changed. You all can find out, but at every school you add to that, if you want to apply to 30 schools, right? You have to pay for that. So you have to be a little bit strategic when you're thinking about what schools you're going to apply for, and you're thinking about what your finances look like for that, for that application process. But in general, It was about 25-ish schools when I was applying. That was like a good number to shoot for. I think people apply to more than that now because it seems like it's gotten even more competitive lately. So probably around 30 schools is kind of a normal number that people apply to. And then, like I said, just thinking about which of those 30 are going to be like a good realistic schools that you'll be able to apply to. Good question.
Did Chiquita, you had your hand up?
Yeah, I was gonna ask, my question was that you mentioned that you did face when you were like applying for like college. I might be wrong, but I think you mentioned to college people said you wouldn't make it to medical school and they were giving you options.
Mhm.
Have you ever like discovered reasons why they were doing that? Was it because like
Yeah, honestly, I don't know because
or
that was that was during
that's
my
happened?
second. Sorry, go ahead.
Sorry, go ahead. Yeah, sorry. I didn't mean to cut you off.
Oh, no, that's okay. So that counselor told me that during the second week of my very first semester in college. So I didn't even have any grades yet. So why was someone discouraging me? I don't know. There's just people out there, unfortunately, who will discourage you. I think it's just the nature of someone thinking like, oh, you don't, you can't be a doctor. You don't look like the doctors I've seen already or the doctors that we see on TV. So I think it's just small-mindedness, people not realizing that. And the issue is I didn't see any doctors that look like me either when I was growing up. And that was kind of the point, right? Like, shouldn't there be doctors that look like me who serve patients who look like me? And I have a ton of Black patients in my panel who love having a Black doctor, many of which who are older who've said, I've never had a female Black doctor. So, I think I'm a precious commodity. So yeah, I encourage people who look like me all the time. Yes, you need to go to medicine because we need people who look like you because we have patients who look like you. So why do people discourage us? I think it's multifactorial. But at the time when that person said that, I did not have anything that should have made that person say that besides the fact that they knew what high school I went to. And I had a good high school GPA. I had a 3.9, I think 3.85, 3.9 when I graduated from high school. So I think I actually was academically pretty good. And they were just discouraging me from the beginning.
I think like no, because as I'm now in high school, that is like happening where like college counselors are saying like to me that oh this may not be like this. They're saying all these they're giving you options, but you don't want to listen. But they're just like trying to tell you oh you can't. This is your GPA. No, they're expecting higher, but like
Yeah, and I think that might be true for some people. I don't know about for high school. I think your college grades really matter more. Like no one ever goes back to look at your high school transcripts when they're thinking about medical school applications process. But I think that people may discourage you because they know how difficult it is to become a doctor. I think there's a very small fraction of people who actually go all the way. So I think there's just a lot of people drop out throughout the process for various reasons. Either it's too hard, they, maybe change their mind. There's probably a million different reasons for why people don't go all the way. But I think if you're one of those people that are determined that you really want to do this, and even if you don't have the academic grades at the moment, there's many ways to bolster that, right? There's post-bac programs. I'm sure you all will learn about that at some point if you don't know about those. So there's post-bac programs, there's extended graduate programs, people get master's degrees. So there's different ways that you can kind of like build up your college graduate GPA to look like you're ready for medical school or can handle the medical school rigor. And it's by no means, I don't want to say that you don't need the background. You do. I think you can be bad at taking tests, but you got to be able to handle what medical school is going to bring you. It is very difficult. I don't want to make it seem like it's easy. It's very hard, but I don't think it's necessarily that you just have to be so smart to do it. I think you just have to be very hardworking to be able to do it. I think we're all smart, but I think different people have to work harder than others maybe to get to the same, show those same levels.
Thank
Dr.
you.
Harris, do you have time for a couple more questions? I know we're
Oh,
at
sure.
time.
Yeah, I
Okay,
don't have clinic till 1. I'm good.
okay. Julian?
Hi, quick question, because medical school is so expensive in the US, is it possible to do medical school out of the country and still be able to practice in the US, or do you have to attend medical school in the US in order to practice in the US?
You are correct. You can practice outside of the US as long as you're able to pass the United States board board certifications for the state. So yes, you can do that. I will say that usually foreign medical graduates have a little bit harder time matching into residency programs within the states. So please be aware of that. There's a little bit of a bias to be 100% transparent, but it's not that it's not done. It is done. It's just there, it's a little bit harder for them to match for residency.
If I could say something about that, there's a U.S. medical school in Grenada that does the first basic years, and then you, as Dr. Harris has said, you then perform your clinicals your last 2 years here in the United States. So it allows you to bridge that difficulty in obtaining a residency. And I know many of these physicians, and they're quite good. They do get a good basic start in an education in preparation.
Yeah, I think if you could do a bridge, that would probably be better because then you would make some of those connections here in the States when you're thinking about residency, because it's almost like you've almost interviewed kind of for the position. So it's probably easier. But I think if you do everything overseas, it tends to be somewhat, not saying you're not smart. I think those graduates are fantastic, but I think it's just sometimes a little bit harder to match in the residency programs.
I see. Okay, thank you.
Jody?
Hello. So I actually have a question about the interview process of going into medical school. And can I ask what it's like? Is it like a job interview with generic questions, or is it a bit more specialized with the actual field?
Yeah, so it's variable. Sometimes they're one-on-one interviews where you're just sitting across from, a representative from the medical school, and it can feel more conversational and less interviewee type. Sometimes it does feel very interviewee type. Most medical schools have moved towards something called the multiple medical interview, MMI, which is more like stations. That's what we do here at UC Davis. So it's I think you rotate through like 10 mini stations for an interview, and the stations are all variable. Some of them you work with someone else who's interviewing on working on communication. They put you through all these little scenarios. Sometimes the scenario is with an actor and they want to see how you just communicate with people. So it's variable, but usually it's one of those situations, a one-on-one, or it's like a station type interactive interview where we get to assess multiple things about you and your personality and how you work with people rather than just you kind of regurgitating what's already on your application.
Okay, thank you.
But you should practice for it. What you need to practice for interviewing for medical school is very important. As someone who had to apply twice for medical school, I can 100% say the one thing that I needed to work on was interviewing. I was very, very timid and shy and didn't know how to really communicate. And I think all of my interviews did not go very, very well. And then when I got a chance to practice and learn how to communicate, relax, conversation, all of those things, it's just a little bit of practice that's needed. Then that's when I saw acceptances in multiple schools. So, it could be multifactorial for you depending on what's going on, but regardless, you need to definitely practice interviewing for med school. Definitely.
Right. Is it Sneha?
Yeah. Okay, so I have one more question. So I'm actually like in high school and I'm not looking in medical school right now. I'm just looking in college and I want to do good in high school and my university. So I'm also looking at UC Davis to kind of get in. Do you recommend like getting to any community college and then get into UC Davis? And like because I'm actually doing a lot of programs right now, like dual enrollment, APs, so I can graduate early. So do you recommend graduating early? Because I'm not sure if like UC Davis accept early graduators from high school.
Yeah, I'm not sure about the early acceptance, but I do know for the junior colleges, there's a lot of programs that bridge from like you do 2 years at a junior college, and then you have pretty much guaranteed acceptance into one of the UCs. And I think that's a fantastic route to go. It saves you money as well, and I think it allows you, gives you a little bit of time to build up in terms of your academic rigor because the junior colleges, they're smaller classes typically, and you kind of get a chance to build up to the kind of that university level. So I would absolutely recommend that if that's something you can do. I'm not sure about the early acceptance. You might have to look more into that one.
Okay, thank you.
Helen? We'll do a couple more and then I'll let you go.
Yeah, no problem.
Helen, do you still have a question?
Yeah. Okay. So, sorry if this is repetitive, but how would I or how do I set myself up as like a strong medical student, like applicant?
Yeah, that's a great question. I think that the first thing is to definitely get in with a pre-med program. If you're in doing college work right now, to get into a program at your college or university that has some kind of pre-med program. So at Sac State, it was C. I think at UC Davis they have MAPS and SNMA. There's got to be some program I'm sure that has like a mentor or counselor that can help you kind of track out your, doing all of your pre-med coursework, right? And then giving you some opportunities where you can do some shadowing and service work. But typically the keys, I really think that the main pillar to getting into medical school is getting good grades. Okay. So you got to focus on school. That's really most important. It's nice to have all of these other community work and service stuff. And you do need to have that at some point, but you really do need to have good grades. So focus on school. And then I always tell people like maybe focus on school the first 2 years of college and then maybe your last 2 years. When you've become a stronger student, you know yourself a little bit more, you can kind of branch out and do a little bit more work. So that might be shadowing. I shadowed an internal medicine physician for a year. I did like one Friday, like every other Friday for a year for just a few hours. I would just drop in and shadow her and see patients with her. I was a volunteer at UC Davis. I volunteered in the pediatric ER. There's only a few short episodes you have to do to complete that commitment. I did very minute, like summer research program where I got to do some research on breast cancer cells. That ended with a presentation. I did a couple of kind of shorter commitment service work, like working at a women's shelter. I did like feeding the homeless. Like I did things that didn't require me to do like like long-term commitments, shorter kind of episodes, but were meaningful and impactful. So you do have to find things that are, passions of yours. If you like working with children or you like working with certain populations of people or women groups and things like that, you have to find like what those passions are. But in general, the pillars are strong educational foundation. So showing that you've, kind of mastered or done pretty well in your science courses and do well in the MCAT, service, volunteer work, clinical shadowing or clinical work, right? And then sometimes they like to see some type of research or a little pitter patter of doing some research. It doesn't have to be bench work, it can be clinical research. But I think the first two are really the most important, is doing well in your schoolwork and some type of service or clinical work. Some introduction that you know what you are getting yourself into with becoming a doctor. So that should include some type of shadowing of the physician. Is definitely needed. You should be able to say, like, I know what a doctor's doing. I'm interested in this, being this type of doctor, or something like that.
Thank
Right,
you.
we have time for just a couple more. Debbie had a question in the chat, but I'll let them speak. Can you repeat your question?
I was looking forward to going into this BSMD program at UC Merced. It's connected with UCSF Med School, and in the BSMD program, you graduate straight from high school and join your college to get your bachelor's, but it's required to do a certain major. And then once you get your bachelor's, they'll send you straight to medical school to complete their prerequisites or the book study in medicine, and then they'll send you off to the clinical trials.
Mm-hmm.
And it's really competitive. And
Mhm.
I've been looking to find volunteer opportunities in hospitals and Red Cross, and unfortunately for all the medical related stuff like blood drives, they only accept volunteers 18 and up.
Yeah.
And so, would you recommend anything else?
Yeah, I'm sure that there's probably, and those are for legal reasons, why you probably have to be 18 to be in a hospital, or, work with patients with clinical stuff. So I get that. I would imagine though that you could still probably do a personal, like set up a personal shadowing experience with a physician or someone in the community, or do some volunteer work through an organization that maybe doesn't have that age requirement. I think a lot of smaller community programs that like feed the homeless and things like that don't always require you to be 18, because they usually take, church groups and family groups. So maybe just digging a little bit more into what else is out there. I don't, unfortunately, can't think of anything off the top of my head that, but if I do, I'm happy. I will definitely send Sam an email. But yeah, I think might have to do a little bit more digging and research to connect you with somebody who maybe could at least let you shadow, um, that maybe wouldn't require you to be 18. I'm so sorry. That's really difficult. That's a hard question to answer.
Well, and
Yeah.
that's the thing about this program. So the Future Medicine program, we have partnerships with Kaiser Permanente and UT Davis for students under the age of 18 to shadow. The problem is that it's very competitive to get into our program as well. So we had mentioned, Dr. Harris, you weren't on for the first half hour. Half the students on this call are part of the in-person program. So they'll be shadowing at the hospitals, and half of them are in the virtual only program, which we offer because we simply can't meet the demand. But to everyone on the call, stay in touch with me, because as the program grows and our relationships grow, you can apply again for the program. We have a spring break program where you shadow a doctor for a week. So we do try to find every opportunity we can, especially while you're in high school, to get into some kind of medical shadowing experience. So I continue to send that stuff out. So hopefully we can get you into something like that. I know there's a lot of people on the call who want to do an in-person opportunity.
Sounds like a true need we
Yeah.
we need for these students.
Excuse me, I have another question.
Okay.
I was looking forward to doing like a EMT degree or something in college to maybe see if I can bump up my resume just in case I don't get enough hospital volunteer hours.
Mhm.
Do you think that would be okay? Or
Yeah, I do know students who do EMT or work as a scribe. I think those are all great opportunities. Just be careful that they don't require you, because sometimes those EMT shifts are overnight, right? So just be careful that that doesn't start to interfere with your ability to perform well in school. So, I had a very small part-time gig when I was in school to help pay for school. but it didn't have anything overnight, and it was very like short shifts that were pretty flexible. So as long as that gives you that so that you don't fall behind in your coursework, then I think that would be okay. And it would be great experience. And don't forget, you all can also do a gap year. I know sometimes everybody wants to go straight through, but sometimes people do need to take 1 year off between finishing college and getting ready to apply for medical school. It can be a great year to kind of, because you have more time, right? You're not in school. You could have a little bit more time to do some more clinical experience as you're getting ready to apply. And all of that stuff can be very impactful and meaningful because it's recent on your application. So, again, everybody's timeline is different. I just don't want you all to feel like everything has to be done like right in the moment while you're trying to focus with all this stuff. This is a long-term journey to become a doctor. It takes a long time. So you have time to do it. I just don't want you all to feel pressure to get it all done in a short amount of time.
All right, we'll take one more question and then I will gather any other questions and I'll email you.
Okay, sounds good.
Alekia?
Yeah, hi.
Hi.
So I was just wondering, it might be a little specific, but is there a time in college when it's too late to decide if you're committed to medicine?
It is never too late. It's never too late, honestly. We are seeing so many what they used to call traditional, which is students who knew they wanted to be a doctor when they started college, right, and go all the way through. So finish college and no breaks, start medical school immediately. That's what we used to call the traditional student. But we are finding more and more, at least at UC Davis, I can't speak for all over the country, but we have much more non-traditional students. So people who have done careers for a couple years and decided that they want to now do medicine, or they did those careers for various reasons in terms of experience before they went to medicine. So we have a lot of non-traditional people. I will say, if you decide late in college that you want to be a physician and you have not done the required coursework, you will have to go back and do that. So you still have to meet all the requirements, but your pathway to medicine might be a little bit different. But no, I would say I don't think it's ever too late, right? You just have to make sure you get all of the requirements and everything needed to come with a strong application, right? As you apply to medical school. So,
Thank you.
yeah.
All right. Well, thank you, Dr. Harris. And we'll actually have an opportunity. We're going to take a little bit of a break, and then our last half hour, we have a couple of medical students from CNU who are in their second year, and they're going to talk a little bit about their experience being in medical school. So we have a little bit more, we can continue the conversation. But thank you so much for sharing your story and answering these questions. It's really, really helpful. This is a great first overview for them to really understand what the process is like, since they're right on the cusp of having to, go out in the world. So thank you so much. And everyone, if you have other questions, email them to me and I will get in touch with Dr. Harris and we can continue the conversation there. Go ahead, and we're going to take a 5-minute break, come back. Actually, we'll take an 8-minute break. So come back at 11:25. You can turn off your cameras, but stay on the call and come back at 11:25.
Dr. Harris, thank you very much for doing this. This was
Oh,
excellent.
no problem. I really enjoyed it. It's so fun talking to the students. Yeah, I just remember all so well this journey. It really sticks with you forever.
Yes, it does. It builds you. Take
Yes.
care. Have a good
Thank
day.
you so much. Bye-bye.
Bye-bye. All right, welcome back, everyone. We have a few minutes before we talk to some medical students, and I'm going to put up, I have 2 polls that I want to put up just to get to know you a little bit. So this one is 5 questions, and it's just a little bit about you. Sorry, give me one moment here. I love watching all these answers come in. A lot of dog people. Okay. Mostly dog people, mostly 12th grade. Summer and fall, not a lot of spring people. What are you doing this summer? Working, volunteering, hanging out with family and friends. We have some travel. No one's going to spend their summer surfing Instagram and TikTok. I don't believe that. I don't believe that for a minute. Maybe they won't spend most of their time doing it, but I'm sure it's on the list. All right, I'll leave the question up for just another 20 seconds or so. We're almost at all of you answering.
Can I ask you something real quick?
Sure.
Okay, I know this program's kind of like an internship, right?
Kind of, yeah, a little bit.
So we're gonna get like a certificate in the end of it.
Yeah.
So
Yeah,
is it gonna be like,
if you attend
yes,
all,
sir.
you can miss 2 sessions and still
Mhm.
get your certificate. But yeah, you'll get a certificate of completion.
Okay, what if you like kind of, so I have like a library leadership in like my new library, and I need to be there like 11:30, not today, but like few days in the program. So
That's okay.
is it like, okay,
Yeah.
so it's just gonna kind of cut off like 30 minutes, and
That's
it's just,
okay.
okay.
Yeah,
Just went
no.
great, thank you.
Yeah, that's fine. As long as you attend most of the day, you'll be counted as present. That's fine.
Okay, thank you.
Okay. I'm gonna
Would
end
this
this.
would-
Go ahead.
question, would this be considered a on our resumes as like a shadowing experience?
If you're in the virtual only program, it wouldn't be considered necessarily a shadowing experience. It's more of like a college and career readiness program in a way. It's a program you attend to learn about different careers. But it wouldn't, because you're not actually shadowing specific doctors in the field, it wouldn't necessarily be considered a shadowing program.
Okay.
All right, CFR. Let's see. Looks like Christopher Lane is on. And Iana is on. Waiting for one more, but we'll give it one more minute. Okay, so we have 2 of our medical students on, so we'll go ahead and get started. Right. So on the call now we have Christopher Lane, who is an MS2 at Cal North State College of Medicine, and Iana Hazard, who is also an MS2 at Cal North State. So they are going to, what I'm going to do is I'm going to break you into 2 breakout rooms. And you're going to have one medical student each one. So half of you will go with Christopher and half of you go with Iana. And you get the opportunity to kind of continue the conversation you had with Dr. Harris and find out about medical school and what their experience is. They're right in the middle of it. So it's a great opportunity for you to learn what they did to get into it, what they did when they were your age, what they found most challenging, and how their journey into medicine went, since they are in the thick of it right now. So give me one moment to get you into your rooms. Thank you so much, Iana, for being on here. Is it Ayana or Iana?
It's Ayana.
Ayana, I apologize. Thank you so much for being on here and talking to the students and giving your perspective and your experience. It's really valuable as they're thinking about what they want to do next. So I very much appreciate you being on.
Of course. You have my email. There were some direct questions that I didn't get a chance to answer, but if anyone wants to shoot me an email,
okay,
they can.
I will share that. All right. Well, thank you so much. And we have our other room back. All right. And then Christopher Lane, thank you so much for being on as well. We really appreciate you sharing your story with the students. And if they have any additional questions, can I share your email with them?
Yeah, please do. Honestly, you heard my story. I would love to talk with anybody here.
Okay, perfect. Well, thank you both for being on today. Before we go, everyone, I have one more poll I want to put up because I want to get a little bit of an idea of what you want to see out of this program.
Will the poll be sent through email as well?
Yes.
Okay, so we can fill it out anytime?
Yeah, you can answer it. If you can answer the question, we have just a couple minutes. If you can answer it here, if you don't get to it, I will email it out as well. But I just want to know what you want to learn from this program so that we can make sure that we try our best to address it, since we're right at the beginning, that we can try to address it and get your questions answered. So I'll leave that on, and I'll stay on the call. We got 3 minutes, and then I'll stay on the call for another 5 or 10 minutes if you have any additional questions after that. But I really enjoyed having all of you on today. For the in-person students, we'll see you tomorrow at the Medical Society, and that's in East Sacramento. You should have the address. If you don't, please send me an email or a text. And for our online students, we'll see you on Wednesday at 10 a.m. on Zoom. And once you answer the question, you are free to take off for the day. Have a wonderful afternoon, everyone.
Thank you, Sam. Thank you, everybody.
Thanks.
Okay, take care, Pablo.
Thank you, all the professors.
You're quite welcome. It's been a
Thank
pleasure.
you.
Thank you. Thank you so much for teaching us.
Thank you.
Time.
Thank you all. We'll see you in a couple of
Thank you.
Thank you. Have a good day.
You're welcome.
So Sam, is it okay if I ask you a question really quickly?
Sure, of course.
So for the in-person students, do we have the in-person class today as well?
No. This week, this week is just virtual on Monday and Friday, and then you'll be with us on Tuesday, Wednesday, Thursday. Tuesday and Thursday at the Medical Society. Wednesday, we're taking the field trip to the Vitalant Labs. But this week is just sort of a workshop week and an intro, and then starting next week, you'll do your 2 weeks of shadowing, and that's Monday through Friday. So, we'll see you tomorrow, and Friday is the last virtual day.
Okay. Thank you.
All right. Thank you, Dr. Williams.
Oh, you're very, very welcome. This the structure was good.
Mm-hmm.
The structure was good. I think the questions made that clear as well. The
Yeah.
things that they were asking about. I
Yeah.
feel I can almost hear Dr. Chuck speaking and saying, "You guys are working too hard. You're too stressed." To the students, I mean, they've self-selected. That's why they're here.
I agree. Well, I'm going to hang on the call for another 5 minutes or so to see if anybody has questions, unless they all
Okay.
sign off.
I'm going to take off then.
All right.
Thanks,
Well, thank
Sam.
you again. All right. Bye-bye.
Okay. Bye-bye.